Hi there. Welcome to the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen. I'm the head of medical services and cardiology at the Georgetown Public Hospital Corporation. We continue our conversations around the COVID-19 pandemic, and we encourage you that if you should have any questions or comments, please feel free to send a WhatsApp message to 620-6275, or you can send an email to docandcovid@gmail.com. As you can see, and I'm telling you, those of you who are listening, that I'm wearing my mask to completely cover my nose and my mouth. This is the correct way to wear your mask. Wearing it under the nose is not correct. Wearing it just under the chin is not correct. I will take it off for the remainder of this discussion because I'm alone here and I'm putting no one else at risk, and no one else is being put at risk by me. The biggest buzz now in 2021, we're in January 2021, is about the vaccines that are available to combat the COVID-19 pandemic. Guyana is yet still some way off from getting our share of vaccines from the COVAX initiative, but it is very important for us to be prepared that when it does come, we understand a little bit more about how it works, why we should take it, and what to expect. As we continue to have questions and comments from viewers and listeners just like yourself, this topic has been recurring. And so the main question that surrounds this is, how do we know that the vaccine actually works? And that's a very important question, because if it doesn't work, then why take it? We're not just going to gamble with an unknown injection and not know what the consequences are. So, important question. How do we know that the vaccine actually works? Before we get into all of that, let's look at a couple of the vaccines that are available and basically try to understand the differences and the similarities. In the UK at Oxford University, a company called AstraZeneca has developed their vaccine, and it is a viral vector type of vaccine that requires 2 doses. Their effectiveness has been claimed to be between 60 to 90%. This vaccine can be stored in a regular refrigerator, and the cost is about $4 per dose. The big ones in the US are the Moderna and Pfizer BioNTech vaccines. The Moderna vaccine is an RNA virus, part of a virus genetic code, and again that requires 2 doses with an effectiveness of 95%, and it requires storage of -20 degrees Celsius for up to 6 months it can be stored. The cost for that is about $33 per dose. The Pfizer BioNTech vaccine is an RNA vaccine, again a genetic produced vaccine, requires 2 doses, and the effectiveness again is 95%, but this one has the requirement for being stored at -70 degrees Celsius. That's extremely cold. That's not the normal commercially available freezers, and the cost for that is about $20 per dose. The one that we are likely to get, or will be available to countries like ours, is the Sputnik 5, which is the Russian vaccine. This is a viral vector type vaccine requiring 2 doses as well, with a 92% effectiveness, and this can be stored at a regular fridge temperature in the dry form. The cost for this is about $10 per dose. Now, we would have discussed earlier that many of the richer countries have bought up most of the production from Pfizer, Moderna for maybe the next year, and it is not very likely that those would be available for us in Guyana and the Caribbean. What we are likely to be able to access are the Russian vaccines, the Chinese vaccine, and the AstraZeneca vaccine, which has been granted approval for production by companies in India. So we stand a good chance of being able to get some of those. If we were to look at the two vaccines that are currently being distributed in the US, patients are actually getting these vaccines. That's the Pfizer-BioNTech vaccine and the Moderna vaccine. If we were to compare them, now remember that both of these actually require significant conditions in terms of cold storage. And the vaccine they're produced by the factories, of course, and they get to the vaccination center either by airplane or ground transport in specialized refrigerated vehicles. And that is how, from the vaccination centers, that's when the patients actually get them. The Pfizer vaccine is comparable to the Moderna in terms of effectiveness. They're both in the mid 90% range. However, the storage requirement is significantly different. The Pfizer vaccine requires a minus 70 degree storage versus minus 20 for the Moderna. And the storage for this Pfizer vaccine therefore requires a different type of infrastructure to be able to utilize this vaccine. From the time it's produced in the factories to the time it gets to countries and health centers, for example, there must be a chain of custody that ensures the integrity of the temperature storage. Otherwise, if it is not stored properly at the minus 70 degrees, it is going to be very challenging to claim that it's as effective as if it was done properly. So it will take a lot more for us to be able to take full advantage of the Pfizer vaccines. We will need all the necessary transportation mechanisms that guarantee the storage of minus 70 degrees, plus all of the methods that we normally use to get vaccines out into the regions. We'd have to make sure that the temperature integrity is maintained, and that can be quite a challenge. The concept that we should understand is something called the cold chain. The cold chain is the system of transporting and storing vaccines at recommended temperatures from the point it was manufactured to the point of use. And that starts from the manufacturer to the distributor, to the vaccine depots, to the provider office or doctor's office before it gets to the patient. Throughout that entire chain, one has to guarantee the integrity of the cold storage process. And how does this vaccine cold storage chain actually work? Vaccines are actually sent to destination countries, let's say Guyana, for example, and it has to be sent to Guyana by specialized aircrafts that have the freezing and the cold storage capacity. From the time it gets to the airport, it will then have to move in specialized refrigerated trucks to the cold room where we would store them. I'm not aware that we actually have those constructed cold rooms just yet. Then it has to be distributed in portable ice boxes to the regional centers. This part is probably a lot easier to do. When it gets to those centers, it then has to be stored in electric fridges between 2 to 8 degrees Celsius, and then carried in portable ice boxes to the local venues where it is actually distributed and injected into patients. So it's a long process that is necessary to ensure the integrity of the vaccine from the time it is manufactured to the time it is actually injected into patients. If we look at the groups of persons who are likely to get the vaccines first, and we can examine, for example, what the company Pfizer recommends, that the first group of patients would be the residents in a care home or older adults and their caregivers. The next group will be everyone aged 80 and over, as well as frontline health workers. The third group are those who are 75 years and over. The fourth group, those who are 70 and over, and those who are clinically extremely vulnerable. Those are persons who you think may not survive these types of infections. The fifth group are those who are over 65. The sixth group, those who are aged 16 to 64 with underlying health conditions. It is very important to know that the vaccines are not recommended for children under the age of 16. So to produce a vaccine, it is not a singular type of approach. There has to be a collaborative effort between the industry that manufactures the vaccine, that's the business community, as well as the academic community that combines the science as well as business. So people generally have ideas what they want to do. Then there's some basic research that actually goes into it. Then the next stage is target identification and preclinical development. Throughout all of that, there is a safety evaluation that occurs, and then it gets to clinical evaluation. Even after the vaccines would have been administered to patients, there is still a process of evaluation for two things. One, and number one, is always safety. So you want to continuously evaluate the population and the subjects to see if the vaccine has produced any adverse outcomes, any side effects. And two is to see if it has been successful in the purpose that it was intended for. So is it safe, one, and two, is it successful in actually preventing the disease? There are several phases involved in vaccine production and development, and the first one, of course, is the preclinical. That's where you're sitting down in a laboratory and you're running tests using microscope, etc. That's the bench type of research. Then phase one, you use a couple of patients, live human subjects, to see if there are any major adverse outcomes. Does it cause death? Does it cause blindness, disability, etc.? In phase two, once it passes phase one, we look at hundreds of people again for safety. And once it passes that, we look at thousands of people for safety and success. And in phase four, there are hundreds of thousands of people. And that is where we are for most of the vaccines being administered to people at this point in time. There are several vaccines that are available. Let us spend some time and briefly examine the ones that we are likely to benefit from in Guyana. We spoke a lot about the Pfizer-BioNTech vaccine. We spoke about the Moderna. But the ones that we are likely to have in Guyana is the Sinovac, which is the Chinese vaccine. And that has been studied in over 27,000 patients. And it's an international study. And it started phase 3 in July of 2020. That is one that we are likely to benefit from. The next one is the Sputnik 5 vaccine from Russia, and that's a viral vector vaccine. It requires 2 doses as well, and the study population was large, 43,600 patients, and those were examined on an international scale, not just in Russia, but this trial was conducted internationally, and that started on September the 7th. These have all been around, and those are the 2 that we are likely to have easier access to. As I would have mentioned before, most of the Moderna, Pfizer vaccines have been bought up by the developed world, and it's not likely that Guyana and other poor countries would be the primary beneficiaries of those in the near future. The effectiveness of the COVID-19 vaccines are also important. The ones that are in the US right now, the Moderna and Pfizer, are thought to be and have been shown to be 95% effective. And the Russian vaccine has been 92% effective, and the AstraZeneca about 70% effective. So I hope you would have understood from our discussions that there's a lot of work that goes in to ensure that the vaccines are quite safe before it is administered to human beings. And now we are looking forward to the success as we ourselves in Guyana can benefit from vaccination programs. So thank you once again for joining me as we continue our discussions around the COVID-19 pandemic. Remember, if you have any questions or comments, feel free to send a WhatsApp message to 620-6275, or you can send an email to docandcovid@gmail.com. Thanks again.